Hello everybody, so welcome to Dent Easy with MJ. So in this class we are going to learn about the different developmental anomalies that are affecting the tongue. So we have different anomalies that are aglosia, macroglossia, microglossia, fissure tongue, ankyloglossia and geographical tongue and many more developmental anomalies that are there in this chapter we are going to study. So here we are going to deal with the ankyloglossia. So ankyloglossia is also called the tongue tie. So in this picture you can see a lingual frenum is seen. So this lingual frenum get attached to the floor of the mouth. So this ankyloglossia or the so-called the tongue tie happens. So this can be of moderate to severe to moderate. They can be classified to severe to moderate based on the location of the lingual frenum. If the lingual frenum completely attached to the floor of the mouth, we can say that it's a complete ankyloglossia. So the problem affecting here is the patient will have feeding problems. So feeding won't be the proper and there will be difficulty in speech also. This is the problems affecting in the ankyloglossia due to the presence of short and thin lingual frenum. So what treatment we can give in order to remove this ankyloglossia is, and as a treatment of the ankyloglossia, what we can do, we can cut the frenum, no? So that is frenectomy can be done in the ankyloglossia. So what I said in the class is, what is ankyloglossia? Ankyloglossia is also called the tongue tie. So what happens here is, lingual frenum, no? There is a lingual frenum and this thick lingual frenum get attached to the floor of the mouth. And the ankyloglossia can be classified based on the location of the lingual frenum. So that is, if this is completely attached to the floor of the mouth, they can say that this is complete ankyloglossia. And the problem having is, that is feeding problem will be there. And problem with speaking will be there, and the method of treatment is frenectomy. So next we are going to learn is, so next anomaly that we are going to learn is the fissure tongue. So what is fissure tongue? Fissure tongue means, in this picture we can see in the dorsal aspect of the tongue lot of grooves and fissures are present now. So if the grooves and fissures are present on the dorsal aspect of the tongue, it is called as the fissure tongue. This fissure tongue is associated with the benign migratory glossitis and Mackensen syndrome as well as the Down syndrome. So in this cases also we can see the fissure tongue. So in the histology, what we can see reated ridges can be seen with hyperplasia and micro abscess will be there. And in the epithelium, we can see a lot of leukocytes. So what we can see, micro abscess is seen, and in the epithelium, we can see a lot of leukocytes can be seen, and reated ridges can be seen, and deep grooves also can be seen between the papilla, and inflammatory cells also can be seen in this fissure tongue. So this is basically no symptoms will be there in this fissure tongue. So they are asymptomatic, and what we can do in treatment, no treatment is there for this fissure tongue. So that is no specific treatment will be there for the fissure tongue. So what we said in the class, what is fissure tongue? Fissure tongue means in the dorsal aspect of the tongue we can see a deep grooves and fissures can be seen. So this is mainly seen in association with the Down syndrome, benign migratory glossitis and Mackensen syndrome. And what is in the histology, we can see a large reated ridges can be seen. Not large reated ridges can be seen, and micro abscess will be there, and inflammatory cells will be present, and the fissure grooves will be present. And what is epithelium? Between the epithelium we can see a lot of leukocytes. So this is the histological feature of the fissure tongue, and no treatment will be there for fissure tongue. It is asymptomatic. This also you have to mention while you are writing the answer. So that is about the fissure tongue. So next we are going to learn is about the hairy tongue. So I'll give a simple example to know about the hairy tongue. So let's imagine as the filiform papilla has the as the cleaner of the hospital or something else, or the house, anything can be imagined. So this what this filiform papilla do? Filiform papilla is a broom now. So that is the filiform papilla will clean the hospital or the house completely. So what happen if the filiform papilla takes a leave, the place become dirty, so that time many impure this microbes, bacteria will get accumulated in the place and will have disease and all everything, So that is what happening here. Here what happens is the keratin formation, keratin get deposited, and as a result of this filiform papilla get enlarged, and then what happens is that here the food debris, bacteria, fungi will get deposited, and that will cause an hairy like appearance, and that is called as the hairy tongue. So what happens is the keratin get deposited in the filiform papilla, and that gives the tongue a hairy like appearance, and that is called as the hairy tongue. Okay. So as the result of this, food debris, bacteria and fungi, all this get deposited, and this will make it more worse. So coming to the etiology, so mainly this can be seen on the people who smokes daily. So in the smokers, this hairy tongue can happen, and whom there is poor oral hygiene. Who has poor oral hygiene, in that people also we can see the hairy tongue. And in xerostomia means the dry mouth person who has a dry mouth, and also who has undergone for the radiation therapy also has a chance of hairy tongue formation. This stands for having the hairy tongue. Okay, so what we said is what is hairy tongue and what are the etiology. So coming to the clinical features, as we said earlier, what the symptoms which does not shows any symptom, that is asymptomatic, that is fisher tongue. No, similarly here hairy tongue also will not show any kind of symptoms, so they are asymptomatic. And in picture you can see that this is a black to yellowish color can be yellowish color appearance of the tongue can be seen, no, and mainly it is seen on the midline. So these are the clinical features, that is no symptoms will be shown, that is asymptomatic, and this is mainly present on the midline, and there will be black to yellowish colored color appearance, this yellowish to black appearance of the tongue can be seen. And next is the histologic features. So histological features, that is hyperkeratinosis can be seen due to the keratin formation and the elongation of the filiform papilla, as well as the food debris and bacteria accumulation deposition also can be seen on the surface. This is all of the histological features. Okay. So what treatment we can give is that we can insist the patient not to smoke, or we can tell them to have the proper brushing, and to destroy this keratin we can do is podophyllin can be given. This is a keratolytic agent. So this keratolytic agent is called the podophyllin can be given as the treatment of choice for this hairy tongue. So what are the things we said? What is hairy tongue? Hairy tongue is mainly due to the deposition of the keratin on the filiform papilla. The filiform papilla enlarges as a result of the food debris and bacteria, fungi will get deposited. So this is called the hairy tongue. And we are going to say about the clinical features, that will be mainly the midline areas affected, that is black to yellowish appearance of the tongue can be seen in this in the hairy tongue, mainly seen on the smokers. And coming to the histology, that is long filiform papilla, and the hyperkeratinosis can be seen. Food debris and bacteria and fungi will get deposited. These are the histological features, and treatment of choice is podophyllin, that is a keratolytic agent can be given. One thing I forgot to mention is that this fisher tongue is also called the scrotal tongue and the plicated tongue. So you should mention this point also while you are making the notes. Okay. So the next anomaly that we are going to learn is the geographical tongue. So telling about the geography, while telling the names, pronouncing the name geography, what comes in your mind? The thing comes in your mind is the map, So in geographical tongue, what happens is that we can see that irregular areas can be seen. So they are called as the geographical tongue. So the other name of the geographical tongue is the benign migratory glossitis. So what we can see here is a well-defined erythromatous depapillated areas can be seen. So this is just in a like in map like, so they are called as the geographical tongue. So they are seen in similar way as the psoriasis, so they are also called as the psoriasiform mucositis. So coming to the etiology, main reason behind this migratory glossitis is unknown, and sometimes it can be due to the stress or some hormonal factors, or the mainly can be also due to psoriasis also. And this clinical feature, what is they shows asymptomatic symptoms, so no symptoms will be seen on the shown by this geographical tongue. So similarly, what are the other anomalies which has no symptom? That is the fisher tongue, geographical tongue, as well as the benign, so that is geographical tongue, hairy tongue, and benign migratory glossitis will not show any kind of the symptoms. Okay, so why this, as the name was as the name suggests, as the migratory glossitis, here this they will change the pattern, so they are called the migratory glossitis, and they will be having the white borders. We can see in the picture, no, there is a white borders can be seen, so there is presence of the white elevated white borders can be seen. So in histopathology, acanthosis and the parakeratinosis can be seen, neutrophils can be seen inside the epithelium, and Monroe microabscess within the epithelium can be seen, and the thin elongated ridges can be seen in the histopathology. And the treatment what we can give is, no treatment is required here. Topical steroids can be given, and broad spectrum antibiotic can be also given in as a treatment of choice for the geographical tongue. So what is etiology? Etiology means can be due to the stress or sometime associated with the psoriasis. Also clinical features, that is asymptomatic, and they are migratory because they are changing the pattern, and there is an elevated white borders can be seen. Histopathology, acanthosis, parakeratinosis, neutrophils inside the epithelium, Monroe can be seen, and thin elongated ridges can be seen. And the treatment of choice is steroids or that broad spectrum antibiotics can be seen. So this is all about the anomalies. We have discussed about ankyloglossia, fisher tongue, geographical tongue, and hairy tongue in detail. So the remaining anomalies will be discussed in the later classes. So thank you all for your listening, and please do like, subscribe, and share to your ones. So see you guys in the next video.